Okay, so we call these classes body signals, okay? So our body is always trying to give us signals or signs that if something is not right, it comes up with a symptom or a sign, right? So this is a list of a list of symptoms: low back pain, tight muscles, loss of range of motion, stiffness, leg pain, swelling, burning, and numbness. So if we feel these things, it's super important that we don't ignore them. And what some people will do is, we'll talk about this a little bit more in detail, where they medicate it and numb it up so it gets rid of that signal. And that is, there's definitely a better way. So I want to go through a little bit of anatomy so we understand what we're dealing with when it comes to the lumbar. So this is the side view of a lumbar disc, probably L4, L5. And so when you look at the side view, there's a couple things we want to point out. Some of the problems that people will have will be a disc issue. So it's either going to be like a herniation, a bulge, and we're going to talk about that a little bit more in some other anatomy that I want to make sure that you guys understand really well. Here's the vertebrae. Right here, this little white area, that's called a facet joint. And facet joints is like whenever you go like this, you're taking these facet joints and going up and down each other. So there is lots of ligaments around all of these, and there is fluid in those joints called synovial fluid. It's power packed with micronutrients. So as long as you have, we always say, I like to say, motion is lotion. And because if you're moving that synovial fluid in and out of those joints, and it winds up helping the healing process. If we don't have that fluid in there, it winds up getting dried out. It winds up becoming arthritic, and it causes long-term problems. So, and this is a proper curve that somebody should have looking at the side view of somebody's lumbars. Okay, so now let's look at a little bit deeper anatomy. This is looking through the vertebrae straight down. This is the disc, not the vertebrae. So when we look at the vertebrae, this is what's called annular fiber. If you were to take a cadaver, you could take a pencil, a lead pencil, and you could just push it right through the bone. You can't do that with a disc. A healthy disc is really very rigid, unless it's compromised. Once it becomes compromised, you get these little tears in the ligaments, and those tears become less elastic, and it winds up causing this jelly-filled donut. This is like very fluid. It's like jelly. And that jelly becomes, when you're under pressure, it winds up pushing that out of the annular fibers of the disc, and it winds up putting pressure on the nerve, okay? So this is a very classic nerve compression. You would see something like this in an MRI. You'd never see it in an X-ray. You can't see that. Now, you could have bulges here, you could have bulges here, you could have bulges here. Anywhere that you were to have a bulge in this area, if it's putting pressure on that nerve, is usually going to be very, very symptomatic. So that only gets worse. So it's so important to address the root of the cause, not the symptom. Does that make sense? The pain comes and goes, but that does not. That gets worse. And usually it's the last thing to show up. When the pain shows up, it's probably been there maybe for years, and it's just not painful, You can measure the lack of function. The range of motion might be decreased, There might be edema, there might be swelling. It might be muscle pain. Like you might have some of those symptoms, but not the really painful stuff. And so, hey, come on in. Here.
You have room?
Yeah, man, we got room. Come on in. So here's what I like to say. This might be bad news for some people, but I think it's great news. At least it's a hope how we can all get better if we have back pain. The eyeballs reproduce itself about every 30 days. Has anybody had eye surgery? Okay. Did they give you liquid Tylenol? Yeah, you put the drops in?
Yeah.
Did they warn you not to use them unless you didn't needed it?
Yes.
They did me.
Yeah.
So I had PRK, and they said, look, if you don't need this, don't put it in there. They don't tell you why, but here's why. Because your eyeballs are reproducing so fast that you stop the healing process. That's why they tell you don't do it. And so anytime we medicate, we're stopping the healing process. If we take Tylenol, Advil, NSAIDs, any of those things actually stop. You want a chair?
No.
Oh, okay. Any of those things actually stop the healing process. So it's one of the worst things we can do. Yeah, short-term gain, it gets rid of the pain, but it is definitely not helping you on the long-term strategy. So, but here's what's exciting about the bones, our skeleton, and the disc. The disc a little bit early. So the bones, we get a brand new spine every 10 years. A brand new spine every 10 years. What that means is the cells in the spine, in the skeleton, do not exist in 10 years from now. They are no longer there. It completely reproduced all new cells. So if we give the body the right nourishment, the right exercise, the right motion, and we give it what it needs to build healthy building blocks, we're going to get a brand new spine. It's going to be a healthy spine if we give it a healthy environment. If we don't fix the environment, it just reproduces unhealthy cells, right? That's awesome. So I think that's encouraging, knowing that if somebody has back problems, just know it's been there for years. It's not going to go away overnight. Pain is a terrible indicator of how healthy you are or your spine is, and it will get better. It just takes time. So I had a patient that came in recently, young guy, x-rays look phenomenal. And I was just like, man, you look great, but clearly a disc issue. I mean, if he sneezed or coughed, just boom, it would cause interthecal pressure, which causes the disc to bulge out, and then it would put pressure on the nerve, and it would just send radiating pain down his leg. And so that's classic disc issue, but the x-rays didn't show it. I go, you need an MRI. So he goes in and gets an MRI. He has 2 bulging discs. And so I was like, well, you got an issue. We know this is an issue. Here it is. He was kind of trying to downplay it, but then once he realized, oh my gosh, there it is, that's the problem. So he started doing some things, chiropractic, and he started doing some things at home, and the pain went away. And I was like, I just told him, I said, look, just because the pain is not there, you are not healed. You go do an MRI, that bulge is still there. It's just not tapping on the nerve, giving that shocking nerve pain. Sciatica, let's talk about sciatica. So a lot of people, it's kind of funny though when I say, I got the sciatica, so sciatica is the biggest nerve in the body. It's formed from all of 4, 5 in S1, and then in the sacrum, you have other nerves that are coming out of there from S1, 2, 3, 4. All those nerves, they all kind of converge and they build the sciatic nerve. And then there's branches off the sciatic nerve that go all the way down our legs, okay? So if, I don't really have a good picture of this, I don't think, but there is a muscle, it's a very common muscle that causes problems that attaches here to the leg and over to the sacrum. It's called the piriformis muscle. So if you have sciatica, if you ever have that issue and you want to bring in your leg up and over, you're going to feel that piriformis muscle stretching. So if you do it on one side, you're like, well, I don't feel it on this side, I only feel it on this side. That's because you have an imbalanced pelvis, usually, and that muscle is going to be tight on that side, loose on, or regular maybe, or loose on this side, or accommodating. So the piriformis muscle, it's a very easy stretch to balance it out and stretch it out and give a little bit of room, make room for the sciatic nerve so it's not laying right on that nerve causing sciatic pain. That's a really easy fix. That's just one of several other areas that can cause sciatica.
What he's talking about is really common misdiagnosed problems. So there's sciatica, true sciatica. That's where you get radiating pain all the way down the leg or below the knee. And then there is what's misdiagnosed often is Piriformis Syndrome. Anytime you hear a diagnosis with the word syndrome means we don't understand it. But what it means is that muscle that sits right on top of that sciatic nerve is tight all the time, coming from a misaligned pelvis. It's stretched and it's putting pressure, constant pressure on the sciatic nerve. That is not sciatica. That will cause pain in the buttocks area, through the hip area, may radiate a little bit down, but it will not go below the knee. And those are the differentials between the two.
All right. Okay, good stuff, right? We're just getting started. Okay, so this would be an x-ray, and this is an MRI, okay? So you can see the difference. I mean, this is bad quality, but you can see the bulging that shows up here out of the disc, okay? There's another thing I want you to notice too. If you ever want to looking at an MRI, what we show is if you look at this and this disc, what's the difference between these two and this one? Empty. What do you mean empty? It's not white, right? This one's black. You see the difference? That's because these are filled with jelly-filled donuts, right? And the jelly is gone. It's dried out. and this is water actually. So what it does is this MRI picks up water. This is a dehydrated disc. So how important is water drinking? We need lots of water to hydrate those discs. So if we're always dehydrated, our discs get dried out and they get thinner and thinner. So we need to make sure we have plenty of fluid in our body. This would be a classic spinal decompression case. We do a lot of spinal decompression here. This right here, look at the lines, the back of the vertebrae right here. This is on an x-ray. You can see there's a break right here in the line. Those lines should line up. Do you see that? So right here, these lines right here should line up. They line up here, but they don't here and here. That is because there possibly has been a hairline fracture here and here, causing the vertebrae to shift forward. Okay? So that is going to put abnormal pressure on the spinal cord or either the nerves. Okay. All right. That's how we get these symptoms. Okay? It's when we have those type of misalignments or challenges in our spine, it's going to cause problems. Now, what's the allopathic route? These are some of the things that they would do. You know, you put some heat. Well, if you have an inflamed back, it's already hot, and you put more heat on it, what do you think it's going to do? It's going to make it worse, not better. It's going to increase inflammation bodies in the area and cause it to even be worse. So that's actually not one of the best things to do. And the bed rest is usually not a good thing to do too, but unless you're in tons of pain, you actually can't do anything but lay down in bed. You should do something, exercise, move it, stretch it. Those are really important to do. Or drugs. Drugs, would you agree that's probably the number one thing that most people would do is they're going to go to the medicine cabinet or they're going to the medical doctor? They treat back pain all the time. They literally walk them out, and I'm not knocking them for it, it's just their MO, it's just what they do. They give them some anti-inflammatories, maybe, they give them a pain reliever, and they say, here, just go get some bed rest. It's very, very common. We hear it all the time. So, well, not just them, but that's the allopathic route. So, and what do the drugs do in the healing process? Is it speed it up or slow it down? It stops it. So there's it's called propioglycals. They're the building blocks of cells. That process of building propioglycals is done. Now, like when you've got drugs in your body, it does not pain drugs, it stops that process of building new cells. So, or if the drugs don't work and they come back and they complain about more, they might say, well, go do physical therapy. And I love physical therapists. I think they're great. I actually literally minutes ago just called a physical therapist to try to work together. And here's the challenge of physical therapy. If they don't take the alignment in consideration and you are exercising or moving a joint over a misaligned, moving muscles and ligaments and tendons over a misaligned joint, do you think you're going to make it better or make it worse? You're going to make it worse. You're inflaming ligaments and tendons that are already inflamed by moving them over a misaligned joint. So the PT, the physical therapist, they've got to be able to take the alignment in consideration or it doesn't get better. We hear that a lot from people who have tried to use physical therapy. What was that? All right, so how bad is it if we treat people with drugs? How bad is this problem in America? Oxycodone, morphine, fentanyl. Have you guys heard about fentanyl lately? Mm-hmm. Yeah, how Mexico is like sending, enough to kill the entire planet. Did you hear about that? Literally, the DEA had confiscated enough fentanyl that would literally kill, the whole population. And so I don't know how you sell that much. It's crazy. So if you look here, this is how much it's on a terrible trajectory. This is 2016. There was a little bit of a dip. And if you remember in the last administration, they made a big deal about fighting big pharma, prices and drugs and stuff like that. Those have all been reversed, unfortunately, and is going to make it very difficult on people's health. Opioids were one of the biggest challenges that we were dealing with, especially in 2010. People were dropping like flies because of opioid addictions. So let's look at that. How many opioids per 100 people in every state, right? This is what this is showing. So where's our state? Out of 65 to 82 people out of 100 were prescribed opioids. Holy cow. 40 people die every single day because of overdoses and addictions to opioids. So just to tell you how often this is being prescribed, 2010, every single American around the clock 24 hours, 7 days a week, 24 hours a day, 7 days a week for an entire month. That's how much we could medicate the entire nation for an entire month. And they could take it every single day. That's how much it was being prescribed. So here's also some of the overdose and the deaths from 1999 to 2010. You can see it's on a terrible trajectory. The red is the opioids, and the dark blue is cocaine, and this is heroin. So you can see how unproportionate opioids are affecting our society. It's all over the news. Everybody's been talking about it. They have been for years. And it's obviously not a very effective way to be able to treat is through medicine. It's not helping. So now some people might go through surgery. So after they go through this whole process, drugs, physical therapy, steroid injections, pain management is managing all the different medications a whole lot better than, here, surgeries. Let's talk about this real quick. So this is a very common surgery that they'll do, a fusion cage or you can see right here the disc has been cut out. But this is one of the things they'll do. You can see this, when you see this white, blocks of space in the disc area, this is when they do injections. They'll do an injection and they'll squirt in cement. And so they call it cement, and it forms like almost like a bone. So when you do this, what happens is that this disc now doesn't move. It's like a shock absorber, all right? And so now it doesn't move. So what happens to the disc above and below? It has to accommodate. It has to make up the difference of the lack of motion of this disc. You can see it at it right here too. So not only did this disc go bad, this one went bad, and they put an injection of cement in that one, and eventually they were going to do this one and this one, but instead what they did is they just said, we'll just bolt it all together so it doesn't move at all. So this is really bad for motion, and it will, for motion, you have no motion. And then what happens is it becomes very arthritic, starts getting bone spurs that start to form. And then you get bone spurs that start to grow into this area here where the nerve comes out. And then once it encroaches into the nerve space, then they have to go and do another surgery and go scrape off the bone spurs to get the pressure off the nerve. And so, anyway, it's a bad route. So what do we do when we have issues like back pain? One thing is we should just ask better questions. If we're going to the doctor, these are some better questions that we could ask. Like, for instance, what are the risks of the procedure? There is risk, and I know that there are many doctors that will downplay that. Not only that, they'll say, you need to have this surgery and you need to have it right away. I've heard many doctors tell my patients this. You need to have the surgery and you need to do it right now, and if you don't, you could be paralyzed for the rest of your life. How's that for a sales technique?
Can I guess, if you've ever been to my Better Results class, I share a story where we had a patient come in. He had a big bulged disc in his back on the MRI. And the spinal surgeon told him, you need surgery and you need it now, or it's only going to get worse. And so he said, well, can I try chiropractic? And the spinal surgeon told him here in town, said, oh, no, you don't want to do chiropractic. If they start adjusting and manipulating this, they could paralyze you. And so, of course, tried to scare the crud out of him. And he had more faith in chiropractic than his surgeon, so he came here. Brought his MRI. I said, I've seen way worse every single day. We started working with him, and I've got pre and post MRIs with a big disc bulge, and then after we worked on him, 14 months later, no disc bulge whatsoever. No symptoms whatsoever. Completely avoided that surgery.
But anyway, here's some other questions. What are the costs involved? And there is cost, not just the surgery, but what's the medication afterwards that I have to be on? And what are the outcomes? If the outcomes are bad, let me talk about outcomes. If somebody's in pain, are they going in to be able to have the surgery for kicks and giggles, or are they trying to have pain reduction? They're trying to get pain reduction, right? That's the driving force. So when you look at the research of pain reduction, it's like 65% they go in with pain and they walk out without pain. 65% walk out with pain and they're okay. The rest of them have failed back surgery syndrome. So this is whenever the backs it's just messed up. And then you go to like the medical doctors I used to work with, that they were kind of the end of the road. When the other physicians failed them in town, they just sent them to this doctor and they were like, hey, and a lot of these guys, they just would numb them up with morphine, or they would literally put morphine injection pumps in their body, and they would have just a little button that when the pain was so bad, they would just sit there, or it was on a time clock and it would just sit there and inject morphine into their spine to numb them up from the pain. So they just numb them up for the rest of their life. So the outcomes is, does it actually have long-term effects? And what are the long-term effects? May I interview some of your patients? Ooh, now you're getting touchy. What does the research say? And if they say the research is 92%, do not trust what they say. That is not true. The research, when it says 92, 97%, I've seen the research that says that too. It's not outcomes. It's not pain reductions. It's did they live or die? That's not what you want to know. So anyway, what are my options? Are there any other ways to be able to treat it? And this is probably the most important. Is this treating my symptoms, or is it correcting the cause of my symptom or my problem? That's a really good question. All right. So here's some research that was done here. This is pretty small. I'm going to put this online. Hopefully I can record all this. And when I do, I'll put these slides on there and you'll be able to read this really well. But these are the sources of all of the research that came up with this. So pain sufferers rated their treatment. Prescribed medication was 58%. Chiropractic treatment was 54%. Physical therapy was 48%. Now, let me talk about this for a second. If you give somebody pain medication like morphine, they're going to be loving life because they don't feel it anymore. But what do we know that is doing to the body? Does it help with the healing process? No, it stops it. So they're going to feel great until the study's over, and then the problem's going to keep coming back again and again and again. So a better option is chiropractic physical therapy. If we listen to our bodies before it becomes a problem, a lot of times we can keep ourselves from ever going underneath the knife and having to do a surgery. And there are some times you just have, that's just what you got to do, you know. But I would exhaust all other efforts. The medical director I worked with in that office, he had back problems. He would never go see a chiropractor. I never could get him to go see any of our chiropractors. He very rarely would even do, I think he only had maybe a few massages in his lifetime. But he had a back that was so bad that sometimes he couldn't show up to work. And I asked him, would you ever do surgery or go into surgery? He goes, I would be on my deathbed before I had surgery. That's how he felt about it. That's because, and it makes you jaded, you know, when you work in that environment and you see patient after patient after patient after patient, and they're all walking in with failed back surgeries or neck surgeries, it makes you a little jaded. You're just like, I would never do that. So we don't want to just mask the symptoms. It's like putting, you know, the tip of the iceberg, the problem, get to the root cause so that we can actually get a long-term correction on this. Let's talk about what a nerve looks like. If we were to break open a nerve and examine all of the neurons, you know, we always like to tell people how many neurons go through the base of your skull. Does anybody want to take a stab at that? Does anybody remember? Don't look at me, I can't remember. I just work here. I'm just kidding. 38 billion neurons, you know, I'm sure it's different in everybody, but 38 billion neurons go through the base of our skull. And those neurons can go all the way down to the big toe, right? So when we examine what is in a neuron, every neuron does different things. They all have different transmitters and different signals that send the message back up to the brain what it is. So we have muscle neurons that we control, the motor nervous system. Then you have the autonomic nervous system that we have no control over. It's no conscious effort goes into controlling that process. What would be an example? Breathing. Heart, right? Hormones, cellular regeneration, healing, right? If the autonomic nervous system is affected, it can affect so many processes that we don't even really think about. It just happens. We kind of take it for granted. So 40 to 45% is autonomic, 40-45% of the nerves are motor. 10 to 15% is sensory, pain. That's a very small portion of our nerves. So it would be better if somebody were to measure function instead of symptoms. So if somebody's in pain, we could have measured the problem way before if we would have measured function. Does that make sense? So like for instance, if somebody dies of a heart attack, when do they usually know that that's a problem? While it's happening. And death usually comes very quickly, right? Can we measure that there's a problem in the heart? We can. We can do a blood test. We can see that there's the biochemistry is completely messed up. We can see that there's improper enzymes, cardiac enzymes that might be in the blood. We can see heart rhythms that are messed up. We can see AFib, which tachycardia, bradycardia. This is too fast, too slow of a heart rhythm. Pressure. So yeah, we can tell when there's a problem before, but we can't feel it. It's kind of like cancer. You don't know there's a problem until a lump shows up and you go to the doctor and you go, my aunt, she just found out she has pancreatic cancer, which is one of the worst cancers. She did not know there's a problem. But when somebody has cancer, they have been sick for a really long time. It just doesn't pop up like that. The body should have been in a healing process, and instead it was degrading every single year, getting worse and worse.
So Dr. Mike, I want to share this with everybody. You guys know we're huge on patient education. We want our patients to be smart about their health and understand where health comes from. It's why we do these classes. But one thing I find is interesting is I've been asking a lot of my patients lately, like when we do that leg lift, when you're face down on the table, okay? When we do that leg lift, that is a muscle test. It is an objective test to see, is there a problem in the body? And if your motor nervous system, if you have pressure on that nerve and we do that test and you can't lift your leg right, that's telling us that you have pressure on the nervous system. Now, that's where we got to figure that out, right? But it's telling us there is a problem objectively. Now let's find it. Let's clear the pressure off the nervous system. What surprises me is how many times I ask a patient when I have them do that leg lift test and they can't do it. And then I go and I find the spot and I adjust it. Okay, do it now. And then boom, now their leg's coming up. They're like, wow, that's so weird. And I ask them, why did that happen? Like, why is it you couldn't do it? I did that adjustment and now you could do it. And what surprises me is how few of our patients can answer that question. Now, if I were to ask you, could you answer that question now? It's because we removed the pressure off the nervous system. And now your nerve is sending the full signal to the muscles, making you stronger.
Yeah.
Isn't that cool?
A subluxation is literally like kryptonite. It makes us weak. Emotionally, physically, spiritually, it affects everything. When we look, this is just the autonomic nervous system and the nerves that control all of our organs. And so the blue ones here, the green, blue, whatever color that is, those are parasympathetic and the yellow is sympathetic. So those are very specific nerves that have neurons on it that have very detailed, like that neuron is, they know what it's for. Here's a fuse box, right? Just like in our house. That fuse box trips whenever there is a subluxation, right? When you put too much power, not enough power, it switches off and tells us that there's a problem.
We have an electrician in the room. He can attest to that, right?
Yeah. Yeah. So anyway, the nervous system works the exact same way. When we have a subluxation, the body can't do its job. It can't communicate that it's supposed to. Now, this is the part I was talking about, the stress hormones. All of the physiological processes that happen when we have stress, pain, sympathetic nervous system is going haywire. These are all the problems that go up. Let's go through these. Blood pressure goes up. Heart rate goes up. Muscle tone goes up. Digestive system goes up. Sex drive goes down. Decreased serotonin levels. We need that to sleep, right? To feel good. Those go down. Increased sensory symptoms. We become numb. Our body numbs up the pain, so now we're not as aware or as sensitive to the signals that our bodies are giving us. Fear and anxiety goes up. Anyway, so these things are all getting jacked up when there's pain and inflammation in our body or when we're under stress. We could be sitting in an 8-hour job under deadlines. That's stress. Again, the nervous system doesn't know if it's a tiger or if it's a screaming boss at you or whatever. Stress is stress, and our body is still going to cope with it by having these things all get out of balance. So chiropractic can help all of these things. It's known to help them all because it helps us deal with stress. We're able to cope with it better, which hence makes all of these things more positive. All right, so we really need to, here's what I know. I know healthy is normal. I know that our body's smarter than any physician on the planet. It knows it's better, it's the best pharmacist on the planet. It knows how to make every drug there ever was to the perfect amount of dose every single time. It's smarter than any physician unless there's interference in the nervous system and it can't communicate correctly. The nervous system is the master system. It's the first system that's created when an embryo is formed. If you were to look at an embryo in a microscopic as it's developing, there's this neural tube that's formed before the suit of armor. And modern life is just stressful. It just is. And if it is, we have to be able to deal with that stress in a positive way. Stress comes from these three areas: thoughts, toxins, and traumas. Traumas, duh. Yeah, I go to the chiropractor because I was shoveling the snow, right? So that's traumas. But toxins can also come from thoughts and then also being poisoned. And I'm not just saying medication is poison, whether it be prescribed or not prescribed. If we're taking, it could be, there was research that said that if we're taking, in most cities in America, if you take an 8-minute shower, that's enough to get chlorine toxicity in your blood. Nobody thinks about that, right? That's toxin, that's poison. Yeah.
So I just want to share a new patient that came in just today, a younger kid. He came in because he's starting to get back pain and never been to a chiropractor before. Didn't know why he had back pain, and then finally in this history we discovered just 3 weeks ago he was involved in a major truck. He was in his truck. He rolled his truck multiple times in the snowstorm, and but he didn't think that the symptoms he was having now 3 weeks later was related to that. Like, you can't roll a truck and not mess yourself up.
And what is a crash in a truck? It's macro traumas, major blunt traumas. Yeah, sure, those are going to cause subluxations. I cannot tell you, that week we had that snow, everybody wanted to get on the schedule. They were like, I'm dying. And then micro traumas, talked a little bit about this, right? All the electronic devices. It is literally retraining our spine what improper posture is. And so we have to combat that. We have to do some type of stretches and exercises to reverse that. We talked about that being the city and the new smoking. Okay, so what does a subluxation do? Well, besides affecting all those stress hormones and stuff like that, joint misalignment, it misaligns the joint, causes low-grade chronic inflammation in the tissues, and then winds up inflammation, nerve irritation, muscle spasm, pain, loss of inhibition, that's the ability for fluid to go in and out, and then joint fixation. Joints fixation. What is that? Well, the joints, they get stuck. So you lose the range of motion in the joint.
Ignore it.
Well, another thing too is that an ugly spine isn't near as ugly as maybe someone who doesn't have a pretty smile. So people will pay a lot of money to have a pretty smile. $4,500 on average, just to be able to fix their smile. What keeps their teeth in their mouth? The spine. Yep. So we need to take care of our spine, and most people ignore that. I think if we wore our spines on our outside of our body, we'd probably care more about it. So how do we find what a subluxation is? We do instrumentation. We look at motion palpation, static palpation, motion palpation, move the joints, see how they're moving or not moving. And then posture, x-rays, we take all that information in our exams, put it all together, and be able to paint a really nice detailed picture about somebody's health or the status that they are. I was just talking to a patient today, and the patient has, the last time he had spinal x-rays, I looked him up because he was a patient here. The x-rays were taken at Gateway Chiropractic in 1989. That was the last time he had his spine checked. And he came in today and he started talking about all of these health concerns that he has. And he was talking about his kidneys failing and kidney stones and swelling in his feet. And I go, this vertebrae right here, T11, goes to your kidneys. And I have no idea what it looks like unless you have updated x-rays. And so he's like, let's take them. So I can't wait to look at those. I haven't looked at them yet, but as soon as I do, I'm going to T11 because I want to know what is that one? Is that about pressure on that nerve that feeds to the kidneys? So anyway, help us in joining this mission with chiropractic and sharing it with our community. And we love seeing these stories and the miracles that happen in our office. I went a little bit long, Dave, and started to be able to cut you off. But if you have any questions, I'll be happy to hang out. We can talk and stuff like that. But other than that,